Thank you to the gentleman from Wisconsin and his issue that he brings up. It's something that some of my state legislators are actually working on, namely Ms. Melissa Garf Ballard. She's a excellent policymaker, lawmaker back home, and this is something that she cares deeply about and is doing quite a lot of good work on this at the state level, and I applaud her for that. Thank you, Madam Speaker, and to all my colleagues for your comments this evening. It's very much appreciated, and as we move into the next couple weeks where we'll get to celebrate the holidays, it's excellent to look back and think about the amazing work that's taken place over the last year. But as it's dominating the headlines and recognizing there is a lot to talk about with healthcare, particularly this week, I want to touch on a few aspects. To be abundantly clear, Republicans are currently dealing with the aftermath of what has been a decade or so failure that the Democrats put in place, that an unaffordable and fraudulent healthcare system. For years, Democrats promised Obamacare would lower costs. In reality, premiums have increased nearly 80% since the so-called Affordable Care Act was enacted. The average premium for family coverage is nearly $27,000 per year. A report from the Government Accountability Office confirms what Republicans have said for years. There is significant fraud associated with COVID-era enhanced premium tax credits established by the trifecta of President Joe Biden and majorities in the House and Senate led by Democrats. Again, in 2021, Democrats put in place what's called the enhanced premium tax credits. They did this during their COVID-era bills, the American Rescue Plan and the Inflation Reduction Act, two bills that were massive expansions for several programs, but in particular, they were able to pass this legislation on party line votes and set it for 4 years. Democrats set this policy during COVID to last for 4 years and expire at the end of this year. So in this study, GAO found that 58,000 enrollees matched Social Security death records, with 7,000 of them being deceased before enrollment began. One Social Security number was even associated with 125 different Obamacare policies in 1 year. That's the first level of potential fraud. The second item is that a $0 premium obviously leads to more fraud, and that's what we've seen happen. Enrollment went up without people using or even knowing that they had coverage. This is something you need a check and a balance on. When they moved the original Obama subsidies, which aren't going anywhere, they're still in place. They're not expiring at the end of this year. They've existed from the start. It's only the enhanced version that the Democrat Party did in 2021. That's what's expiring. And the worst aspect of those, in my opinion, is the fact that you used to be required to pay just 2% of your annual income towards your health insurance premium, and then the federal government, the taxpayer dollars, paid the insurance company the remainder of that. You were only required to pay 2%. Right? That moved to 0% in 2021, and since 2021, you had a massive expansion of people being on these premiums and this insurance coverage, but never using it year over year. But the insurance company continued to get taxpayer-funded subsidies directly to them to cover nothing because they never used it. The percentage of people that weren't using their health insurance went up significantly. And it wasn't like people weren't getting hurt or sick at a similar rate. What was happening was they didn't know they were on the system. They were getting signed up, as part of the GAO study will explain. And then the last final piece that I'm going to highlight here is the income caps. So people that could be making 400% above the federal poverty level, the insurance companies that they were getting signed up for were still receiving these subsidies. Right, so originally the talk about Obamacare was just for folks that are very low income and that were uninsured and didn't have ability to make any payments towards covering their own insurance. So what Obamacare does, it says, all right, if you're 100%, 150% of poverty level, all we're going to require you to do is pay 2% of your income, and federal taxpayers will cover the rest, send it to the insurance, cover that subsidy. In most cases, that's $300 a year that you would have to cover of your own. When that moved to $0, that's when you saw a lot of fraud happening. Because even if you're paying $5, $10, $20 a month towards your insurance, at least you know that's an actual policy and it's going somewhere. When it becomes a $0, all sorts of shenanigans can happen, and that is something that we absolutely have to move away from. And with these subsidies, these enhanced version, these COVID-era subsidies expiring on the Democrats' timeline, and then that $0 aspect will go away. It'll be a few $100s a year for some folks, as opposed to $0. That alone will create an opportunity to cut away a lot of fraud. Look, Democrats created a program that Americans just can't afford. The Unaffordable Care Act works for insurance companies, but it does not work for patients, and it is, like I mentioned, filled with waste and fraud. Insurance revenues have increased from $245 billion when Obamacare was originally passed to $1.4 trillion in 2023. I love it when companies, private sector growth happens. I'm a big supporter of it. I've supported tax policy to ensure that can happen. That type of increase, right when Obamacare gets established, to see that rampant of growth, there is a problem there, right? We can celebrate economic growth across the board, shareholder value, all that stuff. But if you look at the massive increase of year over year, aside from revenue and profits, there's something wrong with this entire situation. And you can directly correlate it to when Obamacare increased or came into play. Look, you can't have it so, insurance companies are seeing such record profits, and at the same time, taxpayers are forced to sort of subsidize these plans. That's not a healthy way to grow a market. So the Affordable Care Act, Obamacare, ACA, it broke the American healthcare system. It created numerous amounts of problems over the last decade. And since its inception, these premium costs have skyrocketed. Networks have shrunk, and the system has become bloated and inefficient. It's important to remember that the enhanced premium tax credit expiration at the end of the year, again, was set by Democrats. And so when they're complaining that Republicans are going to let this expire, that was their timeline, right? And this $0 issue, and then not capping it so it's only targeted towards lower income individuals, that stuff has to go away, right? Even in compromise, bipartisan approaches to deal with this expiration, those aspects had to go away. Those were things that were on the chopping block. And again, I think when folks understand the subsidies aren't going away entirely. If you are a low-income individual, say you're making 100% federal poverty line, and for a single person that's maybe $20,000 a year, your plans are only going to require you to pay a few $100s a year. And just by moving it so that it doesn't go to $0 creates it so there's not so much fraud in the system. And then hopefully over time we don't see this rapid increase in premiums, because that's bad for all Americans. Americans simply deserve better, and they have not been given the health care system with the exception of Obamacare. This is why House Republicans have proposed legislation that delivers real relief. The Lower Health Care Premiums for All Act focuses on lasting policies that provide predictability and transparency. And as the name suggests, this is focused on the entirety of the individuals on health care. Right? This isn't just targeted towards a small 7% of the total population. That's that narrow margin in Obamacare. This is touching every single person, and that's the only way to actually lower health premium costs over time. This bill lowers premiums through pharmacy transparency and cost-sharing reductions. This legislation improves options for workers by expanding access to associated health plans. It also ensures that small and mid-sized employers, that they can offer more tailored, affordable care. And it codifies and strengthens choice arrangements permitting employees to pay pay their premiums pre-tax. So all those things are targeted towards a broad group of people and not just this tiny little subset that we're hearing a lot of complaining about right now. We're actually focused on the entirety of the world that's out there paying more and more for their health insurance. It's time to implement policies that work for all Americans and that provide predictability and affordability. I'm grateful to be a voice from Utah on the Ways and Means Health Subcommittee and during this critical moment, and I am excited to see this legislation move forward, delivering real results, savings, and peace of mind for Utahns and Americans across the country. And with that, Madam Speaker, I yield back the remainder of my time to the chair.